Welcome to Indian Anatomist. Individuals who want to pursue a career in medicine are welcome to check out the YouTube channel Indian Anatomist. Today's lesson is part of ongoing lecture series, and the subject is General Anatomy 3. Anatomical movements of human body. The terminology used for body movements begins with the anatomical position. This terminology precisely describes the movements that result from the contraction of muscles to generate motion at joints. The majority of motions have an opposing or antagonistic motion. Thus, we must be aware of both agonistic and antagonistic movements. By now, you all know about the positions, planes, and directional terms of the body. For your convenience, please click on my 2 past videos that talk about the terms above. In the descriptions, you can find the links to these videos. If you know a lot about these things, today's topic should be easy for you. Let's start the session for today. Set of terms is used to describe movements, typically around joint, that oppose each other. They are called anatomical movements. These anatomical movements are categorized by 3 orthogonal or perpendicular axes through a joint around which an action occurs. These axes are the 1. Front to back or antero-posterior axis, 2. Transverse or medial-lateral axis, and 3 is longitudinal or vertical axis. These visual representation are the animated display that illustrates the different kinds of anatomical planes and their axes of the human body. Please carefully see this animation, that these 3 anatomical planes and their axis are always perpendicular to each other. Now each plane and axis forms the different types of movements in human body, are follows. Number 1, antero-posterior axis in coronal plane, produces adduction, abduction, lateral flexion of body either towards right or left side, inversion or eversion of foot, wrists, radial or lateral deviation, or wrists, ulnar or medial deviation, and scapular elevation, or depression. Coming to number 2, transverse or mediolateral axis in sagittal plane, produces flexion, extension, and dorsiflexion, or plantar flexion of foot. Finally, number 3, vertical axis in transverse plane, produces horizontal adduction or abduction, medial or lateral rotation and pronation or supination of forearm. I showed that the world rotates in different directions relative to the 3 axes. Hope you understand medicos from these basic visual effects. Number 1, in relation to median plane, the vertical axis causes body components, like the globe, to spin or move, medial, or lateral. On the other hand, the globe rotates upwards or elevation, or downwards or depression, due to its transverse axis. In this third animation, the world rotates medially, or laterally, relative to the median plane, but along an antero-posterior axis. The former is called medial rotation, and the later one called lateral rotation. There are general and specialized classifications for anatomical movements. The general anatomical movements are located in many locations of the body, whereas the special anatomical movements are restricted to certain places only. Firstly, I will address the topic of general anatomical movements. What is flexion and extension? In human body, the flexion and extension is frequent movement occurs around the transverse axis. First, I will discuss what is flexion. Flexion is a biomechanical term that refers to the action of decreasing the angle between 2 nearby body segments, or nearby 2 bones, at a joint. For example, flexing the elbow will result in a decreased angle being produced between the radius, ulna, and humerus. Same is applicable to knee flexion, here the decreased angle being produced between the thigh and leg. Anatomically, the leg is the area present between the knee and ankle. Like flexion. The extension is a biomechanical term, denoting the act of increasing the angle between two anatomical segments, or nearby two bones, at joint. For example, elbow extension is characterized by the increased angle between the radius and ulna of forearm and the humerus of arm. In lower limb, the act of extending the knee results in the straightening of the lower leg. At this same time, you will be able to view some additional examples of the flexion and extension that frequently takes place in the human body. To all aspiring medicos, I present to you a task for your consideration. What type of movement is occurring at the wrist joint? Hope you people are trying for this task. At the wrist, the movements that occur are flexion and extension. The term extension of the wrist joint is also referred to as dorsiflexion of the wrist. So, the wrist flexion, also called as palmar flexion. Similarly, within the ankle joint, the movements are referred to as dorsiflexion and plantar flexion of the foot, denoting the flexion and extension of the foot, respectively. This visual representations illustrate the actions of anterior flexion and posterior extension in the cervical region of the human body. Now, this animation depicts the individual engaging in flexion with respect to the median plane. As a result of this, medial flexion is absent, and instead referred to as either right lateral flexion or left lateral flexion. Similar to earlier animations, this image also depicts the phenomena of right lateral and left lateral flexion. So, the absence of medial flexion is evident. What is adduction and abduction? Mostly, adduction and abduction occurs in anteroposterior axis. The terms adduction and abduction are used to characterize movements towards or away from the body's midline. During adduction, the movement occurs towards the median plane or midline. Whereas, during abduction, movement takes place away from the median plane or midline. What is medial and lateral rotation? In anatomical terminology, what is rotation? Turning, or rotating a portion of the body along its own longitudinal or vertical axis is meant by rotation. The act of rotation towards the median plane along the vertical axis is commonly referred to as medial or internal rotation. Conversely, rotation away from the median plane along the vertical axis is known as lateral or external rotation. Colloquially, medial rotation brings the anterior surface of a structure closer to the median plane, while lateral rotation moves it away. The individual seen here is making an action to illustrate the medial and lateral rotation of the arm. Dear medicos, it is important to keep in mind that the elbow should be held in semi-flexed position before completing the rotation. Why it is so? This is because extending the elbow creates pronation and supination of the forearm, in addition to medial and lateral rotation of the arm. This is same like previous animation, demonstrating the medial and lateral rotation. The movement that illustrates the medial and lateral rotation of the thigh is being performed by the individual. In this animation, the subject performing the rotation in relation to median plane. Because of this, there is no medial rotation, instead called as either right lateral rotation or left lateral rotation. Similarly, the lower right image showing the right and left lateral rotations of the trunk region. What is elevation and depression? It is a special type of movement. Elevation is the movement of a part above the body, such as shrugging the shoulders, upward movement of upper eyelid during opening the eye, or the tongue when pushing it out and upwards. On contrary, depression is the movement of a part below the body, such as the shoulders when standing, the upper eyelid when closing, or the tongue when moving it out and downwards. So far, we have talked about the general movements of the body. I will now complete this lesson on general anatomical movements. Please carefully review the content provided and await an upcoming movie that will discuss special anatomical movements.